In this video, we will learn about the antihypertensive drugs. Hypertension is the most common cardiovascular disease, and approximately 1.28 billion adults worldwide suffer from hypertension. It is estimated that around 46% of the adults they are unaware that they have hypertension. It is the most common or the major cause of premature death worldwide. And sustained hypertension it damages the blood vessels in all our organs, including the kidneys, heart, and the brain. And the damage in the blood vessels of kidneys it leads to renal failure. In the heart it leads to heart failure and coronary diseases. In the brain it causes you stroke. So the effective lowering of blood pressure it has been shown to prevent damage to the blood vessels, and it substantially reduces the morbidity and mortality rates. The first thing is the diagnosis of hypertension, and the diagnosis it is based on repeated and reproducible measurements of elevated blood pressure. The AHA, which is the American Heart Association, it has defined that normal values of blood pressure are 120 by 80, 120 for systolic and 80 for diastolic. And if the blood pressure is elevated from these levels, then the patient is described to have hypertension. So even the mild hypertension increases the risk of eventual end organ damage. So the stages is that if the systolic blood pressure is greater than 120 and it's up to 129, the blood pressure is said to be elevated. If the patient has the blood pressure in which the systolic BP ranges between 130 to 139, the person is said to be in stage 1 hypertension. If the systolic is 140 or higher, then the patient is said to be in stage 2 hypertension. And if the systolic blood pressure is greater than 180 or diastolic greater than 120, then the condition is said to be as a hypertensive emergency or urgency based on the end organ damage. And in this situation, the patient has to be treated very immediately. So the staging of hypertension is essential because it helps in deciding the therapy, that whether we're going to use a single drug or we are going to use a combination drug to aggressively treat the hypertension. So this is how we stage hypertension. The other possible risk factors for the end organ damage, they include smoking, they include obesity and dyslipidemia, diabetes, or an old age, family history of cardiovascular disease. All these risk factors along with hypertension, they put the patient into a very high degree of end organ damage. As far as the etiology of hypertension is concerned, we have two types of hypertension. Number one is the primary hypertension, which is also known as essential hypertension, and the other is secondary hypertension, which is secondary, as the name indicates, to some other disease which has caused an increase in the blood pressure. So in the primary hypertension, we do not have any specific cause. The etiology is unknown, and there is no, we have failed to identify a single abnormality that causes an increase in the blood pressure. However, it appears that the elevated blood pressure, it is usually caused by a combination of several abnormalities. It is multi-factorial, and it includes a lot of things, which includes renin-angiotensin aldosterone system or kidneys or um, any peripheral vascular disease. It is said to be a multifactorial cause. Whereas the secondary hypertension, we usually have an etiology, and the hypertension is secondary to that etiology. The most common etiologies that causes the hypertension are renal artery coarctation, coarctation of aorta, pheochromocytoma, Cushing syndrome, primary aldosteronism. These are the major causes of secondary hypertension. In both these conditions, we have a constriction in the arteries, which causes an increase in the peripheral resistance or resistance to the blood to flow. And in these conditions, where we have pheochromocytoma, Cushing, or primary aldosteronism, we have increased levels of catecholamines in the body, which causes an increase in the blood pressure. So this is called as secondary hypertension because this hypertension is secondary to this etiology. We treat the etiology and the hypertension is resolved. So we should know the etiology of the hypertension before we start on treating the patient for hypertension. So in order to understand the normal in order to understand the antihypertensive drugs, we must know the normal regulation of blood pressure. So there is the blood pressure is defined by the hydraulic equation. It is defined as the product of cardiac output and peripheral vascular resistance, or the systemic vascular resistance. This is, we have cardiac output, and this is the peripheral vascular resistance. The cardiac output is basically the blood flow, the blood that is ejected by the heart, and it is also defined as heart rate into the stroke volume. Stroke volume is the blood that is ejected per beat. So the cardiac output is basically the blood flow, and the PVR, or the peripheral vascular resistance, is the resistance that is offered by the vessels when the blood is flowing through it. So the product of these two makes up the blood pressure. So here we have a, I'm going to draw a diagram in order to make it more understandable. So there we have the heart. From the heart, arteries come out. These arteries, they are further subdivided into arterioles. These arterioles combines with the venules. All these combine to make the veins, which goes back to the heart. So these are the arterioles, and these are the venules, and these are the peripheral vascular resistance is just usually mediated by these two structures. So we can define that we have heart, which is the pumping organ, and from the heart we have the arteries come out. From the arteries there are arterioles, and these arterioles, they combine with the capacitance venules, and they go back to the heart. So the cardiac output, it is related to the heart, and the peripheral vascular resistance, it is related to these arterioles and the venules. So the dilation and constriction of the arterioles and venules, it plays a major role in the blood pressure. When these venules are dilated, the blood pressure or the resistance is reduced, and when the resistance is reduced, the blood pressure comes down. And when these arteries, they are constricted, the resistance goes up, and when the resistance is high, the blood pressure is high. So what we do, that either we decrease the peripheral vascular resistance, and would decrease the peripheral vascular resistance by dilating the arterioles and the venules. The blood pressure goes down. Either we decreases the cardiac output, and when the cardiac output is decreased, the blood pressure comes down. So this is how we treat the hypertension. And before we treat the hypertension, or we understand the pharmacology of antihypertensive drugs, we must know the normal regulation of blood pressure. So these are the parameters that we need to remember when we're studying the antihypertensive drugs: cardiac output and peripheral vascular resistance. So there are some other also factors that are involved in the maintenance of blood pressure apart from these two, and the major organ is the kidneys. So what kidneys does is that kidneys, they are very important in the management of volume. They maintain the blood volume because they get rid of the excessive volume and excessive sodium. So they are important in the regulation of blood pressure as they control the blood volume. So the blood volume goes down, blood pressure goes down. So kidney, and they also produce the renin, and from renin we get aldosterone. Now, renin is a chemical compound that retains the sodium and water. So, what will happen when the water and sodium retains? There will be an increase in the blood flow. And when there is an increase in the blood flow, there will be an increase in the cardiac output. And if the cardiac output goes up, blood pressure goes up. Now, the aldosterone, it is a very potent, it also retains water and sodium, and it also plays an important role in the vasoconstriction. So when there is vasoconstriction, peripheral vascular resistance goes up, and when the peripheral vascular resistance goes up, as a result, the blood pressure goes up. We also have some local mediators or local vasoconstrictors, and these are excreted, or they are secreted by the blood vessels. A very important vasoconstrictor is a endothelin. It is secreted from the smooth muscles of the vasculature, and it is a very powerful vasoconstrictor. We also have a vasodilator, which is called as nitric oxide, and this by the help of CAMP, cyclic CAMP, it increases the vasodilation. It's a very potent vasodilator. So all these local mediators, they also play an important role in the blood pressure um, regulation. So we discussed that we have cardiac, the blood pressure, it is a product of cardiac output into peripheral vascular resistance. Cardiac output, it is decided by the heart. This is the pump, or this is the pumping organ of the body, and the peripheral vascular resistance, it is mediated by the arterioles and the venules. And apart from that, we have kidneys, which produces renin and aldosterone. They play an important role by regulating the blood volume in the body. And number fourth, we have local vasoconstrictors, which includes endothelin and nitric oxide. Endothelin is a vasoconstrictor, and nitric oxide is a potent vasodilator. But there are also baroreflex responses, which play an important role in the regulation of blood pressures. So the drugs that are used for the treatment of hypertension, they are classified into four major groups. Number one is the diuretics. Number two is the vasodilators, sympathoplasmic drugs, and the drugs that block the production or effect of angiotensin. So the diuretics, they reduces the blood pressure by depleting the body of sodium, and they reduces the blood volume. The major factor, they what they do is that they reduces the blood volume because they get rid of the excess water and they get rid of the excess sodium. And because of the sodium and water, they reduces the blood volume, they decreases the peripheral vascular resistance, and as a result the blood pressure is decreased. We have direct vasodilators. They directly, as the name indicates, they directly dilates the smooth muscles. And when the smooth muscles of the blood vessels are dilated, what happens is the resistance, or the peripheral vascular resistance, it decreases. And when the peripheral vascular resistance decreases, we have a reduction in the blood pressure. The sympathoplasmic drugs stay blood pressure by reducing the cardiac output as well as by reducing the peripheral vascular resistance. The agents that block the production or effect of angiotensin, as we know that angiotensin, it is a potent vasoconstrictor. Also, it mediates the retention of water in the body. So when we inhibit the enzyme, or when we inhibit the receptor, there is a decrease in the peripheral vascular resistance. There is also a decrease in the blood volume, and this is how the antihypertensive effect is seen.